Dear Sir or Madam, I am writing to you because my mum has a breast cancer. A year ago, she found a lump in her breast. Over 6 months ago, she took 0.5 milliliters active silicone, and after a few weeks, silicone began to dispose of the tumor on the outside in the form of leaking growths. Wow. Silicone, huh? That's scary, but interesting effect. Huh. These tumors grew very large and stank. Yeah, they do stink. And ate my mom's breast off. Yeah, not good. Well, I don't know on YouTube forums whether I can show you some pictures, but I do have some pretty intense pictures here of that very thing. And this is a sad thing. You get too much of that external popping with the tumors all over. And I think I showed you this one picture here yesterday. And these are just not good pictures. You know, when you get yourself in this level of trouble, it's just frightening for everybody involved, you know, and I just feel so sorry. But the thing is, you got to understand the lymphatic system always, no matter what cancer you have or what you've been diagnosed with in terms of diseases. Set those home, give them back to the medical doctor, and realize what's really going on inside your body. Realize it's a fluid problem initially. And the fluid that deals with the acid side of chemistry in the body, of course, is the lymphatic system. Also realize that the only reason that you have a tumor or a cyst is obstructions. You have an obstruction to the flow of this fluid. Then your second thing is now where is the obstruction to the flow of lymph? Why would my lymph nodes swell and then the tissue on the other side break down? Well, understand that the tissue, your cells, eliminate waste, just like babies and everybody else. Cells eliminate waste from the manufacturing process. Call it metabolism, call it respiration, I don't care. So you have waste being produced that has to be eliminated. All good research medical doctors understand this. They might understand the role of the kidneys or anything else, but they do understand the need to get rid of waste, which some medical doctors that put themselves up as professors seem not to. So you have to understand that when you see an expression like a tumor, you have an obstruction. Well, tumors are of the lymph system, so you have an obstruction of the lymph system. Where might that be? Well, first start with the eliminative organs to that structure, and that's going to be the kidneys and skin. If your thyroid's down, you're not going to have the temperature to sweat, so your skin's going to go down. When the kidneys lose filtration, generally the adrenals go down, lower neurotransmitters go down, dopamines and the like, and your kidneys go down. When you lose filtration of the kidneys, your urine is clear. Pee in a jar. If your urine is clear, you're in trouble. That means that your sewer system is obstructed. Well, the kidneys are the main obstructors, to tell you the truth. Then the lymph nodes become hard and they become obstructive. And then, of course, that backs right up to the cell again. So you have to reverse that process to get cancer out of a breast. Well, let's throw that cancer word away because cancer is a foul word meaning nothing. Cells are being damaged by their own acids that they produce through metabolism and respiration. Get rid of those acids. You can only sweat them out or pee them out. You can cough them out too and blow them out, I guess. But systemically speaking, you've got to pee them out or sweat them out. And that's what you want to do. Everything aggressive toward proper kidney filtration and elimination and sweating. Essential. So 100% raw, and when your mother's in this much trouble where these acids just chewed the whole breast off, you want to get the burn salve, start putting the burn salve on this, and you've got to fix why she has the problem. You got to go to the kidneys, until the kidneys can start filtering. It'll break open the lymph nodes under the arm. If our lymph nodes under the arm are hard as a rock, which they probably are going to be with what you're talking about, you're going to have to use some oils to help loosen this up. Laetrile B17 is one. Hemp oil, castor oil, olive oil, grapeseed oil. Any of those helpful. But you've got to get your mom filtering, or there's nothing. I don't care what you do. I wonder who told her to take the silicone, and look what happened. Not good. Mom had removed growths and completely lost her breast. After about a month, these growths began to go back again. And the reason is you haven't fixed why she had it in the first place. Make sense? You've got to fix the elimination of cellular waste. And the kidneys are your focus, and your skin, which is dubbed the third kidney of the body. Mom had another surgery to remove it, but it was not possible to delete everything because she could lose her hand. These growths came out all the time. We do not know how to stop it or dry it. You can only do that by getting your kidneys to filter. You have to open up your obstruction, or she can grow hundreds of these things. I'm looking for help everywhere how to help my mom. I believe that there is someone or something that can help my mother. I joined the photo. I will be very grateful if you know any way how to stop it. Please do not ignore that message. My mom really needs help. I'm not going to ignore this. I don't ignore things like this. 100% raw in a few weeks or a few days. Do a grape fast. Drop her a 40-day grape fast. Dark grapes. If you want lemons, add lemons to that mix. Going to be a strong one jumping right in. But if you want to stop this, you got to get the kidneys to filter. I'd pound kidney herbs and maybe one lymphatic herb. And definitely go after the adrenals. You got to. And that's the only way. Get the burn salve. We have a burn salve. That'll help to heal some of this. But again, this is just acids trying to find a way out. And it'll chew up your whole body. Respect acids. I certainly do. And call and get on the kits. Get on the detox kits. Get on the 14-week protocol. Get on. That's designed for people with this level of problems. And get honking. Because that's the only way you're going to, my opinion, of course, is pull her out of this level. It's the only way you can pull out of any level, really. But that's what I'm saying, guys. You get a serious case like this, forget the YouTube, call right into the clinic.